Hi there, my name is Gabriel Drapos, Chief of Staff at Pearl Health, and I'm going to take a few minutes to walk you through what we're building at Pearl. At Pearl, we believe one of the fundamental problems in U.S. healthcare is that provider compensation is not aligned with their responsibility to their patients. For instance, while 76% of physicians believe they have a prominent role in controlling the costs of their patients' healthcare, only 30% of physician groups are actually in arrangements that are structured for them to benefit from the value they create. And this leads to a situation where primary care providers are not aligned to the outcomes that they're responsible for. So while an average PCP is responsible for $10 million in the annual spend of their patient panel, they're only receiving $225,000 a year in compensation, generally through salary or fee-for-service revenue, neither of which are aligned to outcomes. In an effort to address this problem and reduce the total cost of care of Medicare beneficiaries nationwide, CMS, the agency responsible for regulating Medicare, has released a new program called Direct Contracting. This value-based model converts the volatile fee-for-service revenue stream associated with traditional Medicare beneficiaries into a capitated fixed monthly payment that's proportional to the size of a physician's patient panel, the disease burden of those patients, and the regional cost of care. It also allows primary care providers to receive a portion of the savings they help generate by beating a target benchmark for the total cost of care of their patient panel. In conjunction, Pearl believes these financial mechanisms will help PCPs move away from an assembly line paradigm where they're incentivized to generate billable units, i.e. claims in the form of office visits, and move to a portfolio management mindset that rewards physicians for managing the total cost of care of their beneficiaries while maintaining high care quality. Which brings us to Pearl. Pearl combines the regulatory chassis of direct contracting and the financial mechanisms I just walked through with a set of proprietary solutions to help independent primary care providers succeed in the model and benefit from the value they bring to the healthcare system. At a high level, there are 5 key aspects to the solution that Pearl provides. The first is actionable analytics, so that primary care providers have insight into their patient panel and who needs care. The second is a suite of management tools so that they can ensure their patients are actually receiving care that they need and aren't lost in the healthcare system. Which brings us to preferred networks. In order to ensure that primary care providers have partners in the healthcare system, Pearl designs and contracts smart networks of preferred specialists and facilities that are incentivized and aligned to the total cost of care. Pearl also provides PCPs with regulatory assistance to ensure that they can participate in the direct contracting model and stay compliant with all the model's provisions and rules. And finally, Pearl provides PCPs with financial support. This comes in 2 main forms. One is regulatory capital reserves to ensure that PCPs can participate in the model. And the second is risk sharing, so that PCPs who are newer to taking on risk can do so in a stepwise fashion. So in short, Pearl provides the technology and services necessary to succeed in direct contracting and other value-based models. This ranges from program table stakes like payment administration, so that providers are reliably getting their fixed monthly payment, and member attribution management, so that providers know which patients they're responsible for, all the way to conducting advanced predictive analytics and risk stratification to designing and contracting optimized networks. So that's a quick overview of what we're building at Pearl. If you want to learn more, visit pearlhealth.com, where we have a wealth of resources around direct contracting and what we're building for providers. If that's of interest to you, we also have a jobs page where you can learn about the roles that we're currently hiring for. We'd love to build something great together, so please join us.